What's up, guys? Welcome back to my channel. So today we have an update on Mr. Brian here. So if you haven't seen the last video, we shared that Brian has been diagnosed with thyroid cancer and needed to have a total thyroidectomy. We filmed that video the night before his surgery, just in the nick of time. And now we are 10 days post-surgery and wanted to just kind of give an update. Again, our whole reason for sharing all this is just to help anyone else who might be going through it. When we first found out about, his diagnosis, we just knew nothing. And thyroid cancer is super common, so there's a lot of medical information out there, but actual firsthand experiences are limited. So we just wanted to share the journey and, hopefully help someone else out there who's going through something similar.
Yeah, and feel free to ask any questions, anything we don't cover, ask away, DM us, whatever, because we're happy to answer anything about the whole process.
Yeah, we just wanted to give the update, and obviously well, you actually probably look better than I do.
What? No.
This is what you look like when you are just trying to keep your head above water with two small kids, trying to care for him. He's a terrible patient. He won't just stay in bed and let me take care of him, but I'm thankful too because it's a struggle. So I was going to put makeup on, but I'm like, why? That's not real. I cannot remember the last time I wore makeup. Probably the last video that we
Doesn't
did.
matter, babe.
So, this is what it is. This is just real life, just an update of how it's going.
Beautiful in real life, no makeup needed.
Oh, thanks, baby.
It's true,
You're
babe.
so sweet.
Thanks for everything
This
you've
is what
been
he
doing.
gets to look at, so hopefully he likes it.
I do. Anyway, I went in on Monday and had the surgery bright and early at 7.
Well, first of all, how are you doing?
Oh.
10 days after.
10 days post-op. I'm doing pretty well. I'm feeling pretty good. It's really just down to movement at this point. I mean, the incision is looking pretty good, but it's just my neck is a little stiff. And with the right, removing the stuff from the right-hand side, it's a little tender to the touch. Very happy with how it's going so far. Still a long way to go.
Yeah,
but
I think the surgery went really well, and the recovery has gone pretty well, all things considered. So obviously we still have all the fears of the future, but if we're just trying to live in the present moment, then we're doing good.
doing good. All right, the surgery. So bright and early, 7 a.m. Was the surgery.
5:30.
Oh yeah, 5:30. Technically, yeah, we were there at 5:30.
We had to be there at 5:30, so we woke up at 4:30.
True.
Which is insane.
But we were there by 5:30 and just got checked in and met everybody, the surgeons, the anesthesiologist, all that good stuff. Surgery was at 7. They put me to sleep. I got to take a nice long rest. Longest
Best sleep he's had in a year.
Yeah. No, but she know more about what was happening when I was out.
Yeah, so they, took him back, and they had told me that one of the nurses was gonna call me with updates throughout the surgery. So I was like, please, just have me on the line the entire time. Because I was obviously super nervous and just anxious. So they called about every hour. They had said the surgery was going to be 2 to 3 hours, but then they were saying it's 2.5, and some people were saying 2, but then it ended up being closer to 3. So I wish they would just overestimate. I wish they would have said it's going to be 4 hours, and then I would have been happy when it was 3, instead of feeling oh my God, something is going wrong, when they were not giving me an update and it was getting close to the 3-hour mark. But, I spent a lot of time, the time that he was in surgery, just reading. I have the Bible app on my phone, so I was just reading that, just scripture and devotionals, and it truly helped me.
That's good.
To calm down and not have the anxiety. I think the anxiety before was worse than the anxiety during, up until the end, when it was okay, where is this guy? So then he had to go into a recovery room after the surgery. So they told me the surgery was over, and they said you'll see him in about an hour. Well, it ended up being over an hour and a half until I saw him, which they never called to tell me. So I was just pacing the hospital halls, you know, like when are they going to come get me? I was like, should I go back? Should I call? Should I do it? But they finally came and got me, and they just said that he took a long time to wake up.
Guess I was enjoying my rest.
Yeah.
Keep that anesthesia coming.
The year of sleep deprivation finally caught up with him.
Yeah. But I remember waking up, or I remember at least being in the recovery room when you were there, and I remember the surgeons coming in and saying that everything went well.
And the whole time he's just like, are you okay? Like, how are you? He's like, I'm sorry it took so long. Like, you said that like 20 times. You're like, I'm sorry it took so long. I'm like, why are you apologizing to me? Like, why are you asking how I'm doing? But that's just who he is. That's why I love him so much.
So after recovery, it was moved up to, a more standard hospital room because I was spending the night there. At the time, I was feeling pretty good. I mean, I was able to have some Jell-O pretty much like an hour or so after I got moved up to that room, and then I had kind of a like later lunch around 3, a burger and fries, and there's no like dietary restriction, so I was feeling pretty good. My throat was a little sore, but it was great to be able to eat.
We were worried about the nausea because
Yes.
with his last surgery where he was under general anesthesia, that was a big problem. But they actually use a narcotic-free anesthesia, and then they also gave him some other things like a patch behind the ear. Like,
Oh yeah,
just, like,
one of those like
standard stuff.
like on a
And
cruise ship when you wear the thing.
so he didn't have any nausea, which was really good.
Yes, I think that was a huge difference from the last surgery.
Yeah.
Definitely made me feel a lot better not throwing up for 24 hours.
Yeah, with a giant hole in your neck.
Yeah, exactly. As part of the surgery, you can kind of see here, but when you come out, you have I had 2 drains in, which are basically tubes with holes inside that just help get out all of that excess liquid and stuff, all the fluid after surgery. So it's 2 tubes that come out, and then there's like these bulbs things that create pressure. And I'll tell you, my first surgery and this surgery, those were maybe not the worst part, but they were pretty much the worst part. Like, it causes the most discomfort because it's like tubes inside of you. And I had to keep them in 2 and 3 days.
Yeah. So the other thing that they had told us before the surgery is like that his vocal cords could be affected. They said it was a slim chance though. And luckily,
Yes, I'm talking.
Everything was fine. We didn't know if he would be hoarse. You're like a little hoarse, but
I am.
Not in like the normal course of talking.
No. So let's talk a little bit about pain. So for the most part, it was pretty manageable. I was really just on ibuprofen and Tylenol, and then ice. So the biggest thing is inflammation. So I was on ice as much as I could handle for about the first four days, kind of constantly.
Yeah.
So in the hospital, when I came home, I just had an ice pack on this thing. The ice really, really helped. And then taking the ibuprofen obviously is an anti-inflammatory. So obviously do whatever your surgeon says.
Yeah,
but
you have to do what they say, but
the ice was huge because this one did not get as swollen as my last one did. And this one is, significantly larger than my little one. You probably can't even see anymore up here. And the pain, other than that, I mean, my neck is just really it's really just movement. It's tight. It's sore kind of up in the right section where they took everything out. But by day 10, I'm really basically off my pain medication.
just a little ibuprofen.
Yeah. So all in all, doing well.
Yeah, so he stayed a little over 24 hours in the hospital. Those first, like the day that he was in the hospital, it was like not that rough though, because you were still kind of with the anesthesia. So I think he felt probably better that day than when he came home. But I was glad they kept him in the hospital just so that they could monitor him. Like, it's a major surgery. I feel like you shouldn't just come home right after. So
yeah.
And then once you got home, or the day after you got home, was rough, and then I feel like the next day was the worst day.
Yeah.
So like 3 days after surgery was kind of like the peak of you were more like in bed and not feeling the best.
Yeah, and then I did a few self vlogs that we can
throw in.
Insert these clips in here. When I did my worst day, it's pretty short, but you can kind of tell I was just not. It was not good.
Hey guys, good morning. This is day 2 here in the hospital. Just giving a little update. So last night I got a little bit of sleep. They come in about every 2 hours to check your vitals and make sure you have everything. So it's never the most restful night of sleep, but certainly feel pretty good. Thankfully, I'm not on any hard narcotics or anything, really just Tylenol and ibuprofen. Yeah, yesterday was just a lot of resting and eating and So now this morning I'm waiting on my breakfast to arrive. Meanwhile, the doctor came by and said that everything went well. Incision looks good. And then after that, we think we just get discharged, all the discharge information, and start making our way back home. Hey guys, so update. This is the first full day back. It's about a little after dinner time. It's Wednesday evening. At home, I feel like this is probably the worst day so far. I think we did take out a drain today, so you can see I'm missing one, which is always a good thing, but I think this one hopefully will come out tomorrow, and that's the one you can kind of see that goes up my throat. So that one's like the one that really kind of hurts the most. So looking forward to getting that one out. Other than that, my voice is a little hoarse, but not too bad. So yeah, just wanted to give a quick update. Definitely not the best day, but hopefully tomorrow will be better.
So then after that, it was kind of like feeling a little better every day up until like day 8 or 9.
Yeah, and again, the peak kind of aligned with the drains and taking the drains out.
The drains, they don't take them out. So his were too full in the hospital for them to take one of them out. They were always going to send him home with one, and they ended up sending him home with both. So I got
my little nurse
take them out.
She did good. She was a trooper.
I am like,
she's kind of squeamish too.
I mean, obviously, like, I'm a woman that has had 2 children, so like I can handle things.
She's tough.
But when it's somebody else, especially someone you love and you're causing them pain, like, because it's painful to have those taken out, like, it was horrible.
Yeah.
I didn't think I was going to do it. I thought we were going to call his dad to have him do it, but it was just easier for me to just do it. So I just had to woman up and just
he did
yank
great.
the tube out of his neck. No, it's not.
I mean,
kinda. So I mean, they told us how to do it and everything, the whole process, but essentially, yeah, you're yanking the tube out of his neck. It's probably like a foot worth of tubing that's inside that has to come out. So we were both troopers. We both did good. Yeah. I'm scarred for life, but we both did good.
And it feels so much better once they're out.
So day 8 or 9, you kind of started to like feel kind of not as much improvement every day.
Yeah, more of a plateau. So I think, I was kind of been reducing my pain meds, wasn't really on much, but just kind of felt the same, which is really just like tightness. Obviously your skin is recovering, so like your range of motion is pretty low, and just I had some back and neck pain just because you're like but I finally do on day 10, like I'm starting to get some range of motion. I can do you're not supposed to go up too far, but
yeah, don't go back. And he can't drive until he has like full mobility back. So
yeah, and then the worst,
not that we're going anywhere.
Yeah, and then the worst part is I can't lift anything over 3 pounds for 3 weeks. So
yeah, which is a little hard when you have 2
yeah,
kids.
It's so hard. But we're getting through it.
Yep. So when he came home from the hospital, they had all these medications and everything that he needed to be on, just all this other stuff for after the surgery that he had to take too. And so I was really nervous about that in the beginning, in charge of it, because he's kind of out of it still. So I wanted to be the one, lining all of that up for him. So I had to sit there and read through all the packets and everything, and there were different interactions, like don't take this one within this many hours of this one. It was literally like a math problem trying to figure out the schedule. And I mean, it ended up being like an around the clock schedule.
Yeah, because the main thing is because Synthroid, which is the thyroid replacement, has to be like absorbed correctly, and like there's a lot of rules with like when you can take it.
Yeah.
And one of the medications.
And when you can eat, just figuring all that out. And then he had to take, some of the pills were like really large. And so that was just kind of rough on him. His throat was sore and stuff. So just taking that just around the clock, all the different things, which luckily like it's weaning off and will continue to wean off until it's eventually just the one.
Yeah, just the Synthroid
pill. That has been, and I didn't expect that, I guess is the point. Like they never told us beforehand that he would have to take all of this different things and the amount and the timing and all of that. So they didn't really set us up with being prepared for that. So after I read through everything, I called the nurse practitioner. I just talked through it with her and, made sure it was right. And she probably thought I was crazy or stupid or both, but I don't care. Like, I want to make sure it's right. So I was like going through everything with her and just made sure we got all our questions answered. And, don't be afraid to ask questions because
And
that's what they're there for.
yeah, and it's so important to have somebody there to help support you too, whoever it is, because I mean, I was kind of out of it, so for her to figure that
I
schedule
don't think
out
you would
and
have been
like,
able to figure it out.
no, just, and
I
like,
could barely figure it out, and I was fully coherent.
so it's just super important to have someone there for you to
Yeah.
take care of you. So what's next? So the next thing is really the pathology. So they took the thyroid out and they did they took all the lymph nodes out of the right side. And that's too why the incision's so big. Like, I'm not an expert, but if you just get your thyroid taken out, it's a lot smaller. It's just like in the center part. But because they had to take everything out of the right side of my neck, that's why it's kind of a J off to the side. But anyway, we heard back about a week later on the pathology of just all the different structures. And in fact, there was a tumor in the thyroid, even though it was seemingly invisible on two different sets of ultrasounds. There was a tumor, kind of like what we talked before, where like it was microscopic and we weren't sure, and all of this. There was some kind of peace of mind knowing that it was, in fact, there was a tumor in there that was completely invisible to ultrasound. We did the right thing. We got it out. So at this point now I have an endocrinologist who's kind of the person who will help me with Synthroid and getting that right dosage and all of that. So that's really the next step, is following up with him and going through blood tests and all that. And we'll talk about that more later on. But at this point, it's blood tests, following up with him, and coming up with the plan. So, we're staying optimistic and positive and thankful to God and everything for a successful surgery, and that I'm feeling as well as I am 10 days post-op.
And we feel like the incision is looking really good. Like, it's looking way smaller than the day that he came home. So I know it's going to continue to just fade away. And right now it still has like the surgical glue on it. So once that comes off, it'll definitely be less noticeable too.
Yes. So that's that. Surgery went well. You can wrap it up.
Okay. So we're feeling a lot better, I think, now with everything. We got through the surgery, which was a huge hurdle, got through the hardest part of recovery, and now he's starting the journey with the medication and stuff, but so far so good. Just hopefully that continues to go well and he just feels like himself and nothing changes and all of that. So, I mean, if you're on the cusp of a surgery like we were in our last video, there's really nothing that can calm your nerves down. You just have to get through it.
Yeah.
It sucks. It sucks to be the person going through it. It sucks to be the person that's the loved one just sitting duck waiting to hear what's going on. But
you can make it through, just like the millions of other people who have had this, and everybody's different. But, we trusted our surgeons and God and the good support system we had around us, and thankful for getting through it.
So it's very scary and it's very hard, and you just have to do it. Life doesn't stop. It just keeps going. And no matter how many smacks in the face it's giving you, you have to keep going too. So you got this. And if you have any questions,
please, anything.
He's like an open book.
I really am.
Just ask away.
Yeah, please. I'm happy to answer anything.
All right. So we'll see you guys in the next video. Thank you so much for watching, and leave a comment telling Brian how awesome he is below. Bye, guys.